Hello YouTube. So today is Saturday 22nd of October, meaning I had my nerve block injections 3 days ago. Hello. I don't know why I got my hood up, I literally just got out of bed. As you can see, I'm kind of like up and about. I am taking things easy, but like I am feeling so much better than I did. So to start this video off, I thought I'd answer a few questions that I've had like coming up over and over again on Instagram or on TikTok in my comments. And the most frequently asked thing being like, how did I get it? Did I get referred to this through my GP, or like what was the kind of journey to get there basically? So I guess the easiest thing to do is to give you my whole like timeline from surgery. So I had my surgery almost a year ago to the day. I think it's actually a year ago yesterday. Since then, my recovery has been like really up and down in terms of like pain post-surgery. So it got better for a little while, then it got significantly worse, it got a little bit better again, and then it got worse again. And in that time I've been like trialing different things like the pill and different medications. They prescribed me pregabalin, which I decided not to do anyway. So yeah, I had surgery in October, and then 3 or 4 months later I had my post-op like feedback, what's that session called? Like I had that follow-up appointment like 3 or 4 months later. So that at that point my pain had just started getting worse again. So he referred me on to pain management, and also referred me to an endometriosis specialist that works at the hospital. This is all NHS, by the way. I haven't gone private for anything so far. As with anything with the NHS, these referrals took quite a while. Like they took a good few months. Again, I count myself really lucky because like I know some people wait years. I think in London things do tend to move a little bit quicker. I don't know. Obviously this is just my experience, and I've had a few messages saying like you definitely go private and like try to show it off as NHS. I was like, I genuinely have just been, I guess, really fortunate with timings and everything. Like I've had to not wait overly long, like definitely months but not ever years. So yeah, I saw my endo specialist first, and she wrote down like all of the do you know what, I'm going to take my retainer out because I literally cannot speak. Usually I'm fine with them, but sometimes in the morning when I'm like not really with it, I find it really hard to talk. So yeah, my endo specialist recommended that I see a dietitian, nutritionist, to see if I could do anything with my diet to like prevent endo flares. She also recommended that I see pain management. I also got referred to a pelvic floor physio. So a few months went by and I went and saw pain management. So this is now in May. I saw Dr. Kathari, who is actually the person that did my injections in my hip. She was incredible, so incredibly thorough and wonderful. She gave me a few different options. So I was actually due to start the pill that day, and so I had that. She prescribed pregabalin as well, which can be used for like a whole range of things, and you have to take it every day, but it can be like a good thing for pain relief. Initially I was like, oh my god, amazing, and then I went home, researched it, and decided after a little while that pregabalin wasn't something that I wanted to do. Because you do have to take it every day, I prefer to take something that is as and when. With my mental health the way it is, I don't like to, it's easily kind of influence my mental health. It can change really quickly, and I spoke to a lot of women and people that have tried pregabalin and it's been really awful for them. And I know everyone is completely different, but I decided at that point that pregabalin wasn't going to be the thing for me. So I went away and had to look into the nerve block injections. There isn't that much information as I really like went in my last video. And then after speaking with my endo specialist again, I decided that the pain block route was going to be what I wanted. So then I had to keep calling pain management because to get that appointment was really difficult. Dr. Kathari isn't at St Thomas's all the time. She works privately and in clinics kind of all around the south. Like she's in Kent and a few different other places. But getting that appointment was really, really tricky. I was ringing constantly. If you follow me on Instagram, you would have seen I got emotional a lot of times because I was ringing and not getting anywhere. Then I finally got it booked in, and it was about 3 weeks in advance or a month in advance, and I was absolutely buzzing. Like I could not believe it. Then that appointment got cancelled and like a week before, and I was heartbroken. And then it got put back on like 2 days before, so I found out on the Monday just gone that I was going to have it on this Wednesday. And so yeah, it was an absolute nightmare, but all in all, I got it through pain management, through Dr. Kathari. That is what she recommended for me based on my symptoms. When I had them on Wednesday, there was actually 6 women before me that had it as well. But from what I can remember, it's all a bit hazy, but from what I can remember, it is a relatively new and kind of specialised treatment that has been used in other places in the body, but not necessarily for endometriosis, and it's kind of being tested for endo to see if it helps. Basically, if I'm wrong on any of this, feel free to correct me, but this is just what I've learned from my experience of it. it. My advice when you're trying to get an appointment for anything is keep advocating for yourself. Keep calling. I was phoning like once a week, sometimes twice a week, just to make sure that they haven't forgotten about you. And honestly, I feel like I would have been forgotten if I hadn't done that. Before my injections were booked in, I had a follow-up call with pain management, and they're like, yeah, just wondering how things are going on. And I was like, what do you mean? I've been trying to get booked in for these injections. She was like, oh right, yeah, we can't see any of that on our system. And I was like, I've been calling every day, no, every week since we had our last appointment, and I'm not getting anywhere. So yeah, I really feel like advocating for yourself is so important, especially with these chronic conditions, because unfortunately the NHS is so underfunded and really stretched at the moment. And sorry, I just realised that towel was probably really ugly. It's just drying from the shower. Anyway, so yeah, it's not the people at the other end of the phone's fault that they are really overstretched and don't have a lot of time to get back to people. It's absolutely not their fault, but at the same time you do have to push back and, I mean, not be rude at all, but you know, fight for what you need, fight for the answers that you need, fight for the appointments you need. I wholeheartedly agree with that. Otherwise you will get forgotten and you will get left behind. Another really common question that I had in my DMs was, how much did it hurt, what was the pain scale, and how did it kind of work? So if you don't like details or anything like that, maybe skip past this bit. I'm going to try and go into as much detail as I can without it being too graphic, just to give you the best kind of picture of what it's like. Okay, so I walked into theatre and they said, do you want to keep your phone with you? Do you want to put your earphones in? I was like, yes. So sorted all of that out, put my earphones in. I actually couldn't get anything to play. I was trying to put a movie on and it wouldn't work. So I just had the earphones in without any music, which was fine because it kind of blocked out the sound anyway. But yeah, it was just kind of funny that I was sat there and they were like, you enjoying the music? I was like, yeah, even though I couldn't hear anything. Yeah, that happened. I laid down on the bed. They take your blood pressure and they also attach like the little BP heart rate thing to your finger. The doctors are all kind of moving stuff around. I don't really know, can't really remember that bit. And then Dr. Kathari, the person who was doing the injections, came in. First of all, they clean the area, clean the stomach, like obviously anti-bac it or whatever. And then the local anaesthetic is applied, and I didn't feel that, to be honest. I don't remember that. Yeah, I don't remember that being painful. For me that bit wasn't an issue. The worst bit for me personally was they use a x-ray machine to find the nerve that they're going to be injected into, and there's like a screen, it's kind of like an ultrasound, well, it's an x-ray screen next to you. So I was kind of watching that, and because I'd watched some YouTube videos on what the kind of nerves look like, they kind of look like 3 things like going down like that. And I was just watching it and I was like, wow, I've seen this on YouTube, like it's kind of weird. And that bit was the worst for me because I don't know if it's because I've got a bit of a bigger stomach, I don't know, but they really have to press in to like get that kind of image, and I found that really uncomfortable, whether that's because of endometriosis tenderness and like, can you see Boz just there? That's his tiny little head. Wait, is that it? Yeah. Oh, he's so cute. Yeah, whether that's because it was tender from endo, I don't know, but they really have to push that in there. She did my right side first, and I mean, it's an injection, you can feel it. It's not, if you struggle with endo pain, I feel like your pain tolerance is quite high. I didn't find it like, I wasn't like screaming or like, oh my god, oh my god, oh my god. Like, it was just, I was just aware of it. It's, yeah, obviously it's not comfortable, but it's happening. My left side I found a lot more challenging. It felt like it went in 3 kind of bursts, and I was more kind of like outwardly uncomfortable. I was like, oh, that's, and she was like, it's okay, like kind of reassuring me, and I was like, oh, and then it was like, oh, like that's when it got quite painful. But she was kind of talking me through it in terms of like, oh, just one more and I'm done, and then it was done. And so the injections themselves literally 5 minutes or less, like over so quickly. And then so you're laying down still. It's all done. All of the like nurses and people in the room are like, you okay, can I get you anything? And that's when I started to feel really not well. Sorry, I just had to pick him up because he just looks so cute. Have you been outside? You got grubby paws. Yeah, you're gonna get it on mummy's white jumper. You got food on the side of your mouth, darling. Just there, you saving it for later? Good boy. Are you trying to go back? You don't want to do that because you've just eaten, my love. Yeah, you'll get a dodgy tummy. Okay, do you want to sit on the bed next to mum? Yeah, you can bark at people outside the window. I love you with all of my heart. There you go, darling. Go, use your legs. Use your legs, come on. Oh. Didn't want to use his legs. I was just collapsed there instead. Yeah, after they were done, I sadly took a really bad turn. I think it was a mixture of I hadn't eaten that day because I didn't know whether I was allowed to or not. If you're having like one anesthetic, you absolutely can eat, and I would really encourage you to eat to prevent you feeling this way. Yeah, I hadn't eaten. I was obviously extremely anxious and worried beforehand. The feeling of it all being quite uncomfortable at one point, and like everything, obviously you're in theatre, like it is an overwhelming experience. All of that just hit me at once, and I started to like black out and like have really like, from what I remember, it's just really patchy in my memory, like my vision was going. I felt so unwell. So they kept me laid down, and one of the nurses was just kind of trying to talk me through it, got me some water. They tried to sit me up, and then like very slowly and very gradually, and then it happened again. So they laid me back down, and all the whole time they're just being so lovely. They're like, honestly, there's no rush, like just wait until you feel better. Yeah, so they were so incredibly patient with me and just so lovely. I kept like feeling fine, and then all of a sudden it was like a wave of like horribleness. It was just not very nice. So I ended up staying in theatre for about an hour and a half when I should have probably been there for about 15-20 minutes. Like it honestly would be so quick if I felt like I was kind of annoyed at myself because I feel like if I'd just better prepared and kind of like eaten and like drunk something sugary and like, I don't know, I just could have definitely been better prepared for it. But again, that's not my fault because I didn't know. So yeah, I'd really encourage, if you are going to have this done, make sure you eat a lovely good meal beforehand, and you'll feel probably so much better than I did. Anyway, so I'm in theatre for a little while. They gradually start sitting me up more and more, and I start to come around a little bit. They were giving me squash. We were honestly just chatting. They wanted to know so much about like YouTube and TikTok and stuff. They were just fascinated by it, like how it could be a job and stuff, which made me feel so guilty because I was like, yeah, I earn money just by like posting TikToks and brand deals and stuff. And obviously they are the most intelligent, incredible people, like selfless people that work in the NHS. I just felt so guilty the whole time, like talking about how I earn money versus how they earn money. Like honestly, so weird, but just so lovely to have a chat with them. Eventually, once I felt better, they wheeled me out, and you sit in a recovery area. They wanted me to eat some biscuits and stuff, but I just wasn't feeling up to it, so I just had a glass of squash, and Andre had come to pick me up. I'd really recommend trying to travel home with someone. I don't think they let you drive, but yeah, I'd really recommend it because I took a really bad turn on the way home. Again, I think it was a mixture of, it had started to get really uncomfortable and achy, but also just the overwhelming thing of you've had a procedure done, like it was quite intense. Yeah, I'd really recommend going home with someone. And yeah, that was pretty much it. When I got home, it was quite painful, but not crazy, like nowhere near like a bad endo flare. And then we get to night one. At about 11 p.m, the pain became so excruciating and so painful. And do you know what's really weird is when you're so used to one type of pain, like I'm obviously so used to endometriosis pain, to have a different pain is like really weird. Like I don't know how to describe it. You know, when you have endo, like it kind of forced you to hunch over or to be still, and you're kind of scared to move. This pain was like I needed to move to like, it would get better in like certain positions for like 20 seconds, and then it was like a fire like seizing up all over my hips. All I would say to prevent this is as soon as you get home, start on painkillers. Like I thought I was fine. I was like, yeah, I don't need pain relief, like I'll be fine. Don't do that, like literally do not do that. As soon as you get home, start taking regular pain relief. Like this is like they say on the leaflet that they give you when you go home, like take your painkillers as normal as you would anyway. I just for some reason thought I'd be fine, and I wasn't. So yeah, to prevent that, I would just make sure you're eating, taking painkillers, and try to get to sleep as soon as possible. I ended up taking cocodamol. Oh, you see it in my last video actually. I say I'm going to take some cocodamol because I don't think the pain is bad enough for codeine. It was so annoying because I took cocodamol, the pain got so horrific, and then I obviously couldn't take codeine because I'd taken cocodamol, and it was just horrific. Like I was awake until 4:30 because I just couldn't shake the pain off. Like it just would not go. It was awful. So yeah, just make sure you're staying on top of pain relief. And then the day after, so the first day like home, was fine. I literally stayed in bed all day, and I'd really advise doing that. It can feel like, I just keep comparing it to endo pain, but compared to endo, it's not as bad as endometriosis pain, and it makes you feel like you want to get up and like do stuff. But I'd really recommend just making the most of the rest and allowing your whatever has gone on in that region, obviously I don't know the sciencey stuff behind it, but just allowing yourself to rest and to recover, and for the injections to do their job, you know. Yesterday would have been day 2, and by the way, in terms of like pain relief, I haven't really been taking stuff during the day quite so much. Mostly I start taking it about 5-6 p.m, that's when the pain starts to kick in. And yeah, so yesterday it was fine all day. When I say fine as well, it's like hard to, obviously everyone's pain threshold is different. I'm uncomfortable, like I can feel it, but it's not endo pain, it's not on that scale. So I've just been having a heat mat on me, my BU patches, not taking pain relief during the day, and then at night I've been taking cocodamol, like the 30 codeine, 500 paracetamol, that's the like ratio of it. Yeah, I mean, I can definitely still feel it even when I'm on pain relief. At night it does get significantly worse, but last night I was able to go to the cinema. The cinema is really close by, so I literally just got there kind of when the movie started and left straight away, and it wasn't the most comfortable. Maybe I shouldn't have done it, I don't know, but you can get out and about, you know, like just take it really easy and then kind of do nothing else. Last night was the first night that I've slept like kind of consistently, like chunks of sleep together. I did wake up quite a lot, but it was nice just to get some solid sleep in. And yeah, I feel like that's the most I have to update you on. In terms of what my stomach looks like, there are the tiniest little holes where the injections have gone in, but there's no bruising as of yet. I mean, I would show you, but I can't really be bothered to get my stomach out. Do you know what, actually, let's do it. So I don't even know if you can see that. That is my scar from my surgery, and then the injection went in. Do you know what? I can't even see it. It's there. You have to ignore all the patchiness from my fake tan. There's really nothing to see, so yeah, I haven't been able to worry about that. How it feels is quite tight. If you've had a laparoscopy, you know, like the tightness of like kind of you're half recovered, but it half feels like, I don't know, it feels a bit weird, but that is starting to go. And yeah, like I feel so much better today. I think that's because I've had some time to sleep. But I'm just going to take it easy today. I'm not going to have like a full-on day, but I want to get out of the house, I want to do stuff. So yeah, I hope this video helps in terms of how it's been, how I got this injection. From what I understand of it, I don't think there are loads of people in the country that can administer these, so you might have to travel. If your hospital say it's something that they don't offer, it might just sadly be that they genuinely can't offer it at the moment. I know that my doctor, Dr. Kathari, does go private if that is an option for you. I mean, I don't know what prices would be like or anything like that. Yeah, I'll leave her name in the description and her link to her like professional page where you can see what hospital she works at, and if it is something you wanted to consider to go private. I mean, it's not something I can recommend as of yet in terms of whether or not you should get these injections, because obviously it takes a little while to see the benefits of it, if there are going to be benefits. But Andre said to me this morning, he was like, have you had any endo pain? And I was like, I actually haven't. Like, I've just had this like uncomfortable different pain, so it's kind of weird. I haven't had endo pain for like 4 days, so hopefully that's how it's going to last. And yeah, the injections can last anywhere between 1 and 6 months, so fingers crossed they work and that they do last for like 6 months. And yeah, I hope this video helps. Sorry it was a bit rushed. I literally just woke up and was like, I want to film this because I want to get this up as close to my last video as possible. So yeah, if you have any other questions about what I've had done, and if I can help in any way, please message me on Instagram or drop a comment on TikTok if you don't have Instagram, and we can chat. My vlog that I did on TikTok got over 100,000 views, and it made my heart so warm because all I care about is more people knowing about treatments, because so many people feel trapped and like they have no options. And if we put more pressure and more awareness into this and into endometriosis, we can hopefully do more. So I'm so passionate about, you know, getting my voice out there on behalf of so many of us. So yeah, if you do have any questions, do let me know. Other than that, I hope you have a lovely day, and I'll catch up with you soon. Bye.